Hello, I'm Amber Edgett. Thank you for taking the time to learn more about nursing careers at Chesapeake Regional Healthcare. From as early as I can remember, I have wanted to be a nurse. I was drawn to the power that nurses have to advocate for those who need us most and to truly make a difference. Whether helping patients to a successful recovery or a peaceful death, we forever become a part of each other's lives, and this is a privilege that I have held sacred throughout my career. Nursing care at Chesapeake Regional is based on Gene Watson's theory of caring, in which we use a holistic approach that accentuates the human touch as the foundation of our practice. We are committed to delivering best-in-class, compassionate care to our patients through excellence in evidence-based practice and innovation. Because of this, Chesapeake nurses are role models for nursing practice and are recognized as collaborators, educators, and mentors. Our nursing leaders are an experienced group of professionals who are dedicated to their teams and who take pride in helping nurses achieve their professional advancement. We empower our nurses to lead practice changes through a shared governance structure, and whether you're a new graduate or an experienced nurse, we offer professional growth throughout your career with a clinical ladder program, a nurse residency program, a preceptor program, tuition reimbursement, and specialty certification programs. This is an exciting time for our profession as we are in the unique position to lead change in healthcare. The possibilities to effectively advocate for improved patient outcomes are endless. As a large community hospital, we offer a variety of clinical areas for nurses to practice. I'm confident that we have a position that matches your interests and skills, and you'll feel right at home joining a growing family that has a strong commitment to the community. We welcome the opportunity to partner with you as you discover your potential at Chesapeake Regional. Thank you.
My grandmother was sick in the hospital, and the time that I spent with her, the people that I saw touch her the most were the nurses. In her darkest moments, it was the nurse who was there holding her hand, and I knew that's the type of person I wanted to be when I grew up.
My mom was a nurse. She got ill at a very young age, so that left us to take care of her. So we had to learn some nursing skills early in our age, so I just kind of pursued the career and followed in her footsteps.
I truly believe we have an opportunity to shape people's lives. What you do for that patient in their last moment is just as important as what you do for a patient as they come into the world. What I love about working at Chesapeake is the community. It's definitely a community feel, family oriented. I've never walked down the hallway and not known someone else who was coming in the opposite direction.
I love that it's like a small town feel here. We really care about each other here. We work as a team. We grow our people here. Our voice is heard here.
But I can definitely say here at Chesapeake, you're not a number. Every nurse is accounted for, every nurse is respected, every nurse is wanted, every nurse is appreciated. I love the fact that here at this hospital, you'll meet people who started out as a care partner, and now they're in nursing leadership. So not only do we grow people in their own department, but we grow their span of nursing. You can do anything here at Chesapeake.
Med-Surg covers a variety of patients. A lot of our Med-Surg incorporates telemetry monitoring also. The typical patient could be anywhere from having congestive heart failure to maybe having a lappendectomy for some exploratory abdominal issues. It could be having a wound that won't heal, a diabetic patient. It encompasses a lot. A lot of our surgical units do have Med-Surg overflow, so they do take some of the Med-Surg patients, so there's a mix on the floor. We have an ortho-neuro unit, which does all of the elective knees and hips, and also emergent fractures. They do spinal surgery, neck surgery, and then they also take the Med-Surg overflow patients.
So here at Chesapeake Regional, we have a shared governance model. And in that model, we promote our nurses really being empowered to make decisions and make change throughout the organization.
Success Pace is awesome. The hospital covers certification testing, which is a huge expense to individual. For each individual nurse that has enough experience and that qualifies, they foot the bill for the nurse to be able to take her test for certification. We're very proud of being a niche hospital. We provide elderly patients with the safest, best care in the area. Niche is nurses improving health care for elderly patients. We meet once a month and we discuss ways that we could give better care and safer care to elderly patients. The DAISY Award, it's an organization that works with many healthcare facilities, and a nurse is recognized for going above and beyond for their patients. We award a DAISY recipient every month. So we fight to have that banner, and all of our nurses love it.
Within these walls, you can grow and be any type of nurse that you want to be. If it's a bedside nurse, if it's a leader, if it's a specialty nurse, we have all those opportunities right here in this building.
When I was in college, in nursing school, I worked in the medical staff library, and I was always perusing through their journals, and I liked what I saw, so I asked to do a shadowing in the operating room, and after that I was hooked. It's where I've been for 30 years.
During nursing school, we did a rotation through the OR and really liked it and wanted to work in the OR, but back then OR jobs didn't come open very often. So I stuck with the psychiatric nursing, and almost as a second career, I ran across an opportunity to go into the OR, so I started over. Working at the big corporate hospitals, it's hard to make any changes, it's hard to get anything done. So I came here and interviewed for a position, and when I left here, the only way I could describe it to my wife and my friends was that people here felt normal. You know, it's more of a family feel, and people didn't seem fake.
What we offer here is community feel hospital. It's not a corporate feel, it's very much a home. The nurses that come here, one of the things they tell me quite often is they feel part of a team. They have good correspondence and relations with the staff and the team that they work with, and not only just in surgical services, but interdepartmental as well. The OR at Chesapeake Regional is really unique. We have 13 licensed ORs. We have one procedure room that's embedded in the OR suite. And within those 13 rooms, we have 7 to 9 different specialties, surgical specialties that we perform daily. On average, we do 35 to 45 cases a day. And we have a robust Da Vinci program. We were the first hospital in Virginia to have the XI Da Vinci robot, which is the higher platform.
Da Vinci is an amazing piece of equipment. We use it for 4 specialties: general, GYN, thoracic, and urology.
We also have the Mazor, which is a spine navigation system, and we have the Mako, which is for hips and knees. We're really proud of our robotics program.
The benefits here are good. My favorite would be the tuition reimbursement. I'm currently working on my master's in business administration, and the hospital's paying for the majority of the tuition. So lots of support for continuing education and certification. So the hospital pays $1 more an hour for nurses that get certified in their specialty.
We have competition amongst the different service lines. Each service line has a team leader, an assistant team leader. And we have department metrics that we try to set and meet monthly. So it's a little internal competition on which team's gonna hit the mark first, and then we celebrate with a good lunch, pizza, or something like that, have fun. We're looking for good people to come in and join the team. We're looking for someone that is a self-starter, that is motivated, doesn't need a lot of direction, works well as a team, and always looking to advance themselves. And it's a great place to come if you're looking for a surgical profession.
Labor delivery is my passion. It's absolutely awesome because it's one of the most important days in the parent's life, and when you really think about it, it's the most important day in this baby's life.
So it's nice to see, you know, couples with their new baby, the excitement, and also it's nice to be a part of that. But there's also the part where there's a lot of anxiety and worry and concern. Am I going to do the right thing as a parent? And so again, there's a lot of communication, a lot of teaching within a short period of time to hopefully send them home transitioning and feeling confident in what they can do as parents.
Everybody's here for the right reason. Everybody's very compassionate about the care that they deliver and the patients that we serve. In a community-like setting, you might come in and you're a labor nurse one day, you're a nursery nurse the following day, or mother, baby nurse, are all in the same day.
Here, you're more defined as far as who you are, where you work, what you're doing. I think here, you don't get lost among the minions. There's a good orientation program. We don't try to rush people through just to have a body on the floor.
It's more of a family. You're not just a number. You actually feel like you make a difference and you're part of everything. So there's lots of educational opportunities as well.
So we bring anywhere from 2,400 to 2,600 births into the world a year. We have a level 2 special care nursery, so that means that the babies are 32 weeks and above or 1,500 grams and above that we can take care of here. We're able to keep mom and baby together here versus transferring them to another hospital that would take care of them.
We are very flexible. If you want to have an all-natural birthing experience, we have a tub that you can labor in. You have portable monitors that you can use. You can get up and walk around, and then there's a very wide variety of doctors too. So we have every kind of opportunity, I feel like, here.
And then the last night that they're here, we even give her a trial run. So we let the baby stay in the room with her to make sure that she knows how to take care of the baby and that all of her needs are met before the baby goes home with her.
At Chesapeake, this is a place where you have every opportunity in front of you. You can work days, you can work nights, you can work on labor and delivery, you can work anywhere in the hospital, but everywhere that you work, you have great support, you have good flexible hours. You have more opportunities here than in other local hospitals, like with educational reimbursement and your certifications and conferences and growing in your field itself that you can't get elsewhere. I absolutely love Chesapeake Regional Medical Center. Like I said, I grew up here. I started out as a nurse's aide. I went to residency, like nurse residency, did an internship. I've become a staff nurse and then a preceptor, relief charge nurse, and been able to get every single opportunity I've ever wanted. And it has been a family affair that my mom works here. My brother actually works here now in nuclear medicine as well. So I think that says a lot that we all keep coming back here because you're just part of a bigger group.
We are really driven for our patients and to deliver the patient experience, and that makes us unique to where others don't have that opportunity when they're not a community hospital.
Nursing allows 24-hour compassionate care. We touch the patients.
I've always wanted to really live a life of service. Nursing really kind of gave me that path, you know, to where I could really serve others.
The beauty of nursing is that it offers a variety of practice areas that can appeal to different types of nurses and the style and their interests.
If you really want that home feel, that caring, caring about you, then I would tell them to come to Chesapeake. You know, I think we have a great team here. I think we have a great leadership team here.
The one thing I hear from nurses coming to this hospital from other hospitals is that you're not just a number here. It's really a family-like environment. When I walk down the hallways, I know everyone that I pass. If I need help from an orthopedic nurse, I know somebody I can reach out to. If I need help from a surgery nurse, I know somebody who I can reach out for help. We develop a teamwork relationship here that really in the end provides better patient care.
We have 2 critical care units. One is a mixed acuity unit and then the ICU. We get all types of patients. ICU 4 on the 4th floor is dedicated to neurosurgical patients, and we actually have special trained nurses that take care of those patients.
We have a designated respiratory therapist within our department. We actually have mental health technicians that work within our department as well, in addition to our ED techs and admin support secretaries. We do have 3 trauma bays. The rooms are just a little bit larger, but all of them are set up to be able to handle any type of emergency situation.
New grads coming in are going to be assigned a preceptor to help them learn some of the coursework and also learn how to take care of patients in a hospital. They're also going to be assigned an ambassador that helps them kind of with some of the softer skills coming into the hospital. In the critical care unit, we use special orientation programs to teach them what they need to know to transition into that environment.
We actually do a lot of team outings, team bonding things. We actually try to do something at least once a month.
So whether that's laser tag, they actually just had a karaoke night last night. We do have an annual holiday party that we host every year.
We try to mingle with each other. It's like a family here.
You know, our staff, they work hard and, you know, they play hard too. Nearly anyone can come in and adjust monitors and perform skills, but it's really the true nurse who can come in and touch a patient and a family member's heart and help them with the recovery with their spirit, their mind, and their body. Certainly our profession, like many others, has grown in intensity of our knowledge base, but at the end of the day, the reason we're here at the bedside is the reason nursing developed from the beginning, is to provide compassionate care.